Let's talk about Wilma, a 56-year-old woman. She visited her general practitioner because of complaints of fatigue, difficulty concentrating, a sore tongue, and paresthesias in her hand and feet. An earlier laboratory examination showed no abnormalities. A friend suggested that she may have B12 deficiency. So her blood was examined again, and the serum concentration of B12 was 157 picomole per liter. The laboratory reported that the normal values of serum B12 are between 148 and 600 picomole per liter. We need to realize that there is huge variability between the different commercially available serum B12 measurements. Also, there is a day-to-day variation of serum B12. As an example, someone's B12 concentration may be 150 picomole per liter on one day, and 120 picomole per liter on a different day. Many studies have shown that a serum B12 concentration within the normal limit, above 148 picomole per liter, does not exclude deficiency. We now know that serum B12 concentrations may be influenced by specific genetic polymorphisms or mutations. Until now, over 15 single nucleotide polymorphisms have been identified that influence serum B12 concentration. It also should be noted that if someone uses oral B12 supplementation, this may result in serum B12 concentrations just within or sometimes above the so-called normal range, without abolishing someone's symptoms. Doctors have tried to use other blood measures to assess the B12 situation. Holotranscobalamin, abbreviated as HOLO-TC, is the biologically active form of vitamin B12 in the blood. Only vitamin B12 that binds to transcobalamin is available for uptake into the cells of our body. A value below 30 is considered abnormal, but values between 30 and 70 are considered indeterminate concentrations. The reference values also depends on the assay method which is used. It was thought that HOLO-TC measurement could pick up a B12 deficiency earlier. Only few laboratories are using this method currently. Measuring serum concentrations of methylmalonic acid, which is also called MMA, and homocysteine may be helpful in establishing B12 deficiency, especially in people with borderline serum B12 concentrations, for example those between 148 and 300 picomole per liter. Earlier, doctors thought that serum MMA can be a good marker for B12 deficiency. And indeed, when we follow this path, it appears that about 5 to 10% of people with an intermediate serum B12 level, between 148 and 300, have an elevated MMA concentration. However, research in Germany, which was published in the year 2013, showed that serum MMA concentration was normal in 52% of individuals with active B12 levels below 20. The latter is actually considered a severe deficiency. This means that MMA is not a very good marker of B12 deficiency. Another biomarker which can be measured in the blood is homocysteine. Again, the concept is that homocysteine goes up when B12 is deficient. Unfortunately, serum homocysteine is less specific for B12 deficiency. It can also be elevated as a consequence of deficiency of folate and vitamin B6, and in people with impaired renal function or low thyroid function. This graph shows the relationship between serum B12 and MMA in a population-based study in the USA, the NHANES study. In the graph you can easily recognize at least 4 important issues. 1. In general, MMA levels go up when serum B12 levels gradually become lower. 2. In people with impaired renal function, MMA levels are higher for a given B12 level than in people with normal renal function. 3. In the red box, you can clearly see that part of the participants had a low serum B12, below 148, but still a normal MMA. 4. MMA already starts to increase when serum B12 levels become below 300, as indicated by the red arrow. What happened to Wilma? Her doctor decided to have an additional MMA measurement. This turned out to be 800, clearly elevated. Normal values for an adult would be below 280. This finding supported the diagnosis of B12 deficiency, and Wilma was advised to start with intramuscular B12 injections. Additionally, her doctor ordered extra tests to look for the cause of her B12 deficiency. This will be discussed in a future video. In summary, there is not one single laboratory test which can reliably determine whether a person has B12 deficiency or not. The complaints that a person reports should be leading in suggesting whether there may be B12 deficiency. A serum B12 concentration below 148 supports the diagnosis and should lead to adequate treatment. Normal blood levels of MMA or homocysteine do not exclude B12 deficiency.